You waking up with stiff, aching hands, those familiar pangs of arthritis making even the simplest tasks, like holding a coffee cup or turning a doorknob, feel like a challenge. In the search for relief, a curious home remedy has been making the rounds, placing a frozen spoon on arthritic hands for instant comfort. It sounds almost too simple, doesn't it? A spoon, chilled in the freezer, applied gently to the skin, promising quick, soothing relief from joint pain. But does it actually work? Could something so basic really calm the deep, throbbing discomfort that comes with arthritis? Or is it just another example of a feel-good trick that provides temporary comfort without addressing the real issue? Today, we're going to dig deep into this claim. We'll explore where this idea came from, what science has to say about it, whether there's any logic behind the frozen spoon trick, and most importantly, what seniors living with arthritis should know before trying it themselves. First, let's take a moment to understand why this idea might seem appealing. Arthritis is a common condition, especially as we age. It's estimated that nearly half of adults over the age of 65 in the United States experience some form of arthritis, with osteoarthritis of the hands being one of the most common types. The constant ache, stiffness, and occasional swelling can be frustrating and, at times, even debilitating. So, when a simple, no-cost method like a frozen spoon promises quick relief, it's no wonder that many seniors are willing to give it a try. But where did this idea come from in the first place? The frozen spoon trick seems to have emerged from a combination of folk remedies and the broader practice of cryotherapy, using cold to reduce pain and inflammation. For centuries, cold treatments have been used in various cultures for everything from injuries to fevers to joint pain. Applying ice packs, cold compresses, or even snow to an area of discomfort is a well-established method for temporarily reducing pain and swelling. But the frozen spoon, that's a more recent twist. Some people speculate that the frozen spoon idea may have been inspired by beauty hacks, where chilled spoons are used to reduce under-eye puffiness. Others believe it's an adaptation of classic cold therapy, simply using what's available in the kitchen as a convenient tool for relief. It's easy to see how a chilled spoon could feel soothing against the skin, especially on a hot, inflamed joint. But does that soothing sensation actually translate into meaningful pain relief for arthritis sufferers? That's where the science, or lack thereof, comes into play. When we look at the scientific literature, the story of cryotherapy for arthritis becomes more complex. Cold therapy is indeed a legitimate technique used in physical therapy and rehabilitation settings. Applying cold can constrict blood vessels, reduce blood flow to an area, and temporarily numb nerve endings, all of which can help decrease pain and inflammation in the short term. However, there's a big difference between using a carefully controlled ice pack or cold therapy system for a specific period and simply grabbing a spoon from the freezer. Moreover, the effectiveness of cryotherapy depends on several factors: the temperature of the object, the duration of exposure, the area being treated, and the underlying condition. For arthritis in particular, some studies have found that cold therapy can help reduce pain and improve joint function, but the benefits are usually modest and temporary. There's little to no scientific research specifically focused on using a frozen spoon for arthritis relief. That doesn't mean it's completely ineffective, but it does suggest that any benefits are likely limited and short-lived. So if there's no strong scientific evidence for the frozen spoon trick, why do people keep trying it, and in some cases, reporting that it helps? Part of the answer lies in the power of belief and the placebo effect. When we expect something to work, our brain can actually trigger physiological changes that lead to a perceived reduction in pain. The act of doing something, anything, can itself be comforting, especially when we're dealing with chronic discomfort. Plus, the sensation of cold on the skin does provide a kind of temporary numbing, which might feel like relief in the moment. even if it doesn't address the underlying cause of arthritis pain. Of course, there's also the possibility that some people simply find the cold refreshing, or that the ritual of using the frozen spoon becomes a small act of self-care that brings comfort beyond its physical effects. These psychological factors are an important part of the story, and they remind us that when it comes to managing pain, the mind and body are deeply interconnected. But while the frozen spoon trick might seem harmless, there are a few things seniors should keep in mind before trying it. Applying extreme cold directly to the skin can cause discomfort or even minor skin damage if left on too long. Seniors with conditions like Raynaud's phenomenon or reduced sensation in their hands should be especially cautious, as they might not feel the cold as intensely and could risk skin irritation or frostbite. And while a cold spoon might feel nice for a few moments, it's no substitute for a comprehensive arthritis management plan that includes exercise, joint protection strategies, and, when needed, medical treatments. So what should you do if you're living with arthritis and looking for safe, effective ways to manage your symptoms? Stay tuned, because we're about to dive into the science of cryotherapy, the possible mechanisms behind cold therapy's effects on arthritis pain, and what the experts really recommend for seniors seeking lasting relief. Let's begin by exploring the science behind cold therapy, or cryotherapy, and how it has been used in the management of arthritis and joint pain. The basic principle of cryotherapy is simple. Applying cold to the body can reduce inflammation, slow nerve conduction, and temporarily numb pain. In physical therapy clinics and rehabilitation settings, cold therapy is often used after acute injuries like sprains or strains, and sometimes as part of a comprehensive arthritis treatment plan. But what happens in the body when we apply cold, and can a frozen spoon really replicate these effects? When cold is applied to the skin, it triggers a process called vasoconstriction. This means the small blood vessels in the area constrict, which helps reduce blood flow and, in turn, inflammation. That's why ice packs are often recommended for swelling and bruising. Cold also slows the activity of nerve endings, decreasing the speed at which pain signals travel to the brain. For someone with arthritis, this can mean a short-term reduction in pain sensation, but it's important to note that these effects are usually temporary, lasting only as long as the cold is applied and for a short period afterward. The optimal temperature for cryotherapy in clinical settings is usually much colder than what a frozen spoon can provide. Professional cold therapy systems can cool to temperatures well below freezing, and the treatment is typically applied for specific durations, often around 10 to 20 minutes under controlled conditions. A frozen spoon taken from the kitchen freezer, on the other hand, starts at a higher temperature, typically around 18 degrees, and quickly warms up upon contact with the skin. This means its cooling effect diminishes rapidly, often within a minute or two. While it might feel refreshing, it's unlikely to deliver the sustained cooling needed for a meaningful therapeutic effect. Still, for some people, the brief cooling sensation of a frozen spoon might be enough to create a sense of relief. This is where psychological factors come into play. Our brains are powerful, and the placebo effect is a real phenomenon. Studies have shown that when people believe a treatment will help, they often experience a reduction in symptoms, even if the treatment itself has no physiological impact. This doesn't mean the relief is all in their head in a dismissive sense. The brain can release endorphins and other chemicals that actually reduce the perception of pain when we engage in rituals we believe will help. It's also worth considering the comfort factor. The act of pausing, taking a moment to apply a frozen spoon, and focusing on self-care can be soothing. This small ritual can create a sense of control and agency over one's condition, which can be incredibly valuable when living with a chronic condition like arthritis. But while the psychological benefits are real, they should not be mistaken for actual treatment of the underlying joint damage or inflammation. So what do medical professionals say about using cold therapy for arthritis? Overall, the consensus is that cold can be a helpful tool for short-term relief, especially during arthritis flare-ups when joints are hot, swollen, and inflamed. Applying an ice pack, or, in theory, even a frozen spoon, for 10 to 20 minutes can help reduce inflammation and temporarily numb pain. However, experts caution that cold therapy is not a cure, and its benefits are limited to symptom management. It's also not recommended for everyone. For seniors with poor circulation, neuropathy, or conditions like Raynaud's, cold therapy can pose risks, including skin damage, numbness, or even worsening symptoms. Let's talk safety. If you're considering trying the frozen spoon trick, it's important to use it properly. Always wrap the spoon in a thin cloth or paper towel to avoid direct contact with the skin, which can prevent frostbite or irritation. Limit application to no more than 5 to 10 minutes at a time, and pay attention to how your skin feels. If you notice numbness, tingling, or discomfort, stop immediately. And remember, while a spoon can offer a momentary cooling sensation, it's not as effective as a properly applied cold pack or therapy glove designed for safe use on arthritic joints. So where does that leave us with the frozen spoon trick? On one hand, it's a harmless and inexpensive way to introduce a brief cooling sensation that might provide momentary comfort. On the other hand, it's not a scientifically validated method for managing arthritis, and it's certainly not a substitute for evidence-based treatments. Think of it more as a quick, feel-good tool, like splashing cold water on your face when you're hot, rather than a medical intervention. Now that we've covered the basics of how cold therapy works and where the frozen spoon trick fits in, let's take a closer look at the potential mechanisms that might explain why some people feel better after using it. We'll explore the role of nerve desensitization, the gate control theory of pain, and how simple rituals can influence our perception of discomfort. Plus, we'll discuss alternative methods that offer safer, longer-lasting relief for arthritis in the hands. Let's start by exploring the potential mechanisms that might explain why the frozen spoon trick feels helpful for some people with arthritis. One key concept is the gate control theory of pain. This theory, first proposed in the 1960s, suggests that the spinal cord acts as a kind of gate for pain signals traveling to the brain. When non-painful stimuli, like the cold sensation from a spoon, are applied to the skin, they can essentially close the gate to pain signals, reducing the brain's perception of pain. In simple terms, your brain can't fully process the sensation of cold and pain at the same time, so the cold might temporarily distract from the underlying ache. There's also the role of nerve desensitization. When cold is applied to the skin, it slows down the electrical signals in nerve fibers, particularly the small, unmyelinated fibers responsible for transmitting pain. This temporary numbing effect is why ice packs are recommended for minor injuries and swelling. While a frozen spoon might not stay cold long enough to significantly alter nerve transmission, it could still provide a momentary sense of relief by slightly dulling nerve signals, especially in sensitive areas like the hands. Another factor to consider is psychological comfort. Many seniors have spent years managing chronic conditions, and sometimes the small, familiar rituals, like using a frozen spoon, can provide a sense of control and calm. It's the same reason people might apply a cool compress to a headache or sip warm tea when feeling stressed. These actions might not cure the problem, but they create a moment of comfort and care, which can have real benefits for emotional well-being. And when it comes to chronic pain, addressing the emotional side of the experience is just as important as the physical. That said, it's important to be realistic about the limitations of the frozen spoon trick. Even if it offers a few minutes of soothing relief, it doesn't address the underlying causes of arthritis pain, things like joint inflammation, cartilage breakdown, or changes in bone structure. And if someone relies solely on a spoon in the freezer for arthritis management, they might miss out on more effective treatments that can improve joint health and function over time. So what are some better options for seniors looking to manage arthritis in the hands? For one, structured cold therapy, like reusable gel packs, arthritis-specific ice gloves, or cold therapy wraps, can provide more effective and safer cooling than a household spoon. These products are designed to contour to the shape of the hand and maintain a consistent therapeutic temperature for the recommended duration, usually 10 to 20 minutes. They also come with protective barriers to prevent skin damage, which is especially important for seniors with thinner, more delicate skin. But cold therapy isn't the only option. For many seniors, heat therapy, like warm compresses, paraffin wax treatments, or warm water soaks, can also provide relief, especially when stiffness is a primary concern. Heat helps increase blood flow, relax muscles, and improve joint flexibility, making it a valuable tool for managing chronic arthritis discomfort. Some people even alternate between hot and cold therapy, a technique called contrast therapy, to manage pain and stiffness. Beyond temperature-based therapies, there are other evidence-based strategies that can make a real difference for arthritis in the hands. Gentle hand exercises can help maintain flexibility and strength. Activities like squeezing a soft ball, stretching fingers, or practicing specific movements recommended by a physical therapist can keep joints mobile and reduce stiffness. Joint protection techniques, such as using larger, easier-to-grip utensils, wearing supportive gloves, or modifying tasks to reduce strain, can also help seniors maintain independence while protecting their hands. And of course, medical treatments are often a key part of arthritis management. For some people, over-the-counter anti-inflammatory medications like ibuprofen or topical creams can provide temporary relief. Others may benefit from prescription medications, steroid injections, or even newer biologic therapies designed to target the underlying inflammatory processes in certain types of arthritis. For seniors dealing with arthritis, it's always wise to have a conversation with a healthcare provider about the best combination of therapies for their unique situation. What works for one person might not be the right fit for another, and a personalized approach is key to finding relief and maintaining function. Ultimately, while the frozen spoon trick might offer a brief moment of soothing relief, it's just one small piece of the puzzle, and not necessarily the most effective one. It's important to view it as a temporary comfort measure rather than a solution. The key to managing arthritis lies in a holistic, evidence-based approach that combines safe self-care techniques, appropriate medical treatments, and lifestyle adjustments that promote joint health. In the next part of this video, we'll dive into safety tips for using cold therapy, expert recommendations for arthritis management, and how to make informed choices that balance tradition with science. Now let's talk about safety, because even simple remedies like the frozen spoon trick carry some risks, especially for seniors. It's easy to think of cold as harmless, but when it comes to applying extreme temperatures directly to the skin, there are important precautions to keep in mind. First and foremost, direct contact with frozen objects, whether a spoon, ice pack, or gel pack, can cause skin irritation or even minor frostbite if left on too long. This risk is especially high for seniors, as our skin naturally becomes thinner and more fragile with age. Additionally, conditions like Raynaud's phenomenon or peripheral neuropathy, which are more common in older adults, can make the skin more sensitive to cold or reduce the ability to feel temperature changes. This means someone might not realize they're damaging their skin until it's too late. So how can seniors safely use cold therapy, including the frozen spoon trick, if they want to give it a try? Here are a few important guidelines. Always wrap the spoon or any cold object in a thin cloth, paper towel, or clean washcloth before applying it to the skin. This helps prevent direct skin contact and reduces the risk of cold burns. Limit application time. Start with no more than 5 to 10 minutes at a time. If you're using an ice pack or therapy glove, follow the manufacturer's instructions. Typically no more than 15 to 20 minutes per session. Check the skin frequently. If you notice any numbness, tingling, redness that persists, or skin that looks pale or blotchy, stop immediately. Avoid cold therapy altogether if you have conditions that impair circulation or sensation in your hands, unless approved by your healthcare provider. While it's okay to try a frozen spoon as a quick, cooling touch, it's not a long-term solution for arthritis pain, and it should never replace more comprehensive, evidence-based treatments. So what do experts recommend for managing arthritis in the hands, especially for seniors? The Arthritis Foundation and organizations like the American College of Rheumatology emphasize a multifaceted approach. Here are some key components. Exercise and movement. Gentle hand exercises help maintain joint flexibility and strength. This might include stretching the fingers, making fists, and releasing, or using a soft ball or putty for resistance. Movement also promotes blood flow, which can aid in joint health. Heat therapy. For chronic stiffness, heat can be more effective than cold. Warm compresses, heating pads, or paraffin wax dips can help relax muscles and ease tension. Medications. Depending on the type and severity of arthritis, over-the-counter options like acetaminophen or ibuprofen may help. Topical creams with menthol or capsaicin can also provide localized relief. For some, prescription medications like corticosteroids or disease-modifying drugs are necessary. Joint protection techniques. Simple changes like using ergonomic kitchen tools, jar openers, or specially designed pens can reduce strain on the hands. Wearing compression gloves or splints may also provide support. Alternative therapies. Some people find benefit in practices like Tai Chi, yoga, or massage therapy, which can improve flexibility, reduce stress, and support overall well-being. However, it's important to remember that these should complement, not replace, medical care. Healthy lifestyle habits. A balanced diet rich in anti-inflammatory foods, staying hydrated, maintaining a healthy weight, and managing stress all contribute to overall joint health. Ultimately, managing arthritis is about finding the right combination of strategies that work for you. While the frozen spoon trick may offer a quick, soothing sensation, it's not a replacement for a comprehensive, long-term approach to arthritis care. It's okay to experiment with simple comfort measures, but always keep the bigger picture in mind. So let's bring this all together. The frozen spoon trick for arthritis relief is an interesting example of how simple, everyday objects can become part of our health routines. It's a low-risk, feel-good ritual that might provide a brief sense of relief, but it's not a magic cure. Understanding how cold therapy works, the importance of safe application, and the need for a broader arthritis management plan is key, especially for seniors who deserve the best possible care for their joints. Before we wrap up, I want to leave you with this thought. It's natural to seek out home remedies and quick fixes, but the real power lies in making informed, safe choices. By combining practical self-care strategies with expert guidance, you can take charge of your arthritis management and feel more empowered every day. If you found this information helpful, please let us know. Know in the comments below. Have you ever tried the frozen spoon trick? What are your go-to methods for managing arthritis pain? We'd love to hear your thoughts. Don't forget to like this video, share it with a friend who might benefit, and subscribe to Stronger After 60 for more balanced, evidence-based insights on health and wellness for seniors. Thank you for watching, and we'll see you next time.